morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. So picture this, a restaurant where everyone with a reservation sends boxes of raw food from different grocers without notice for the chef to then prepare and cook once they arrive for dinner. Well, something kind of like that is going on in the healthcare industry, and there's some debate on whether it's good for patients. It's a practice called WhiteBagging. Alan Van Zandt explains.
What does the term WhiteBagging mean? Well, let me explain it to you like this. This is how we usually pick up our medications from the pharmacy of choice before we take it home. It's in a white bag. WhiteBagging is also a term linked to medication deliveries in boxes like this. In this context, WhiteBagging is used to describe when a payer-mandated pharmacy is selected for you to deliver infusion or IV medication to a hospital or clinic. You didn't choose the pharmacy, the payer or insurance company did. And here's the problem. This payer-mandated box with life-saving medication is often time-sensitive or temperature-sensitive and can be sitting here on this loading dock where temperatures can soar, or here on a doctor's desk. In either situation, extreme temperatures can make the medication ineffective or spoiled, while sitting on the doctor's desk means the medication and time are lost. WhiteBagging of infusion or IV medication puts patients at increased risk for harm. WhiteBagging bypasses the processes and safety checks in place at hospitals and clinics to ensure all medication is safe. WhiteBagging means delayed treatment, difficulties in coordinating care, and anxiety for patients and providers.
And our guests today are going to help us make better sense of this practice and what it means to you if you're a patient. We are happy to have with us Karen Braidman. Karen is with the Kansas Hospital Association and is Senior Vice President of Clinical and Strategic Initiatives. Also joining us is Leanne Scott, Senior Director of Pharmacy Operations and Services here at the University of Kansas Health System. So good morning and welcome to both of you.
Good morning.
So this is something people are learning about, myself included. So we're going to dive right in and explain what this is. And Leanne, I want to start with you. So if I'm a patient, explain really why I should care about this practice. Why would I care where my medicine comes from as long as I just get it?
Well, you know, I'd say sometimes it's not easy, and we've had patients be pretty frustrated about how hard it is to get a simple medication. And just as important to us are the safety checks and workflows that we've put into place to take good care of patients and prepare medications. And when we receive those medications in an unusual way, then that takes us off of our normal process.
Makes sense. Okay, so you actually surveyed hospitals across Kansas to see what they thought of WhiteBagging. What did you find out?
We did. A few months ago, the Kansas Hospital Association and our partners with the Kansas Council on Health System Pharmacy surveyed hospitals across the state to ask about the impact that WhiteBagging has had on their patients and their facilities. And I want to share with you a few lessons that we learned. You can see there in the green bar, the vast majority of hospitals that responded to our survey indicated that there was a negative impact to their patients' care because of WhiteBagging, either in timeliness or appropriateness or safety of the care. The very few hospitals that responded that there wasn't an impact, you see that in that little blue bar, those were a couple of hospitals who responded that they actually do not even allow white-bagged medications at their facility. And another important lesson that we learned when we surveyed hospitals across the state was that there's a lot of waste that has been introduced into the healthcare system because of this insurance company practice. We asked hospitals if they had any problems with white-bagged medications, and almost half of them, that's the bar in green, almost half of hospitals indicated that they had to throw medications away that had been white-bagged because they couldn't guarantee that those medications were safe.
Okay, so not good. Leanne, though, what kind of medicine are we talking about, and what kind of patients are in need of these type of medications? Are they expensive medications, or is it across the board?
Yeah, these are specialty medications, most often for serious health conditions like cancer or blood and brain disorders. And so, you know, I think they are very expensive, and we know how expensive they are. And when we see some of the delays that occur, or if there's some other reason that we cannot use the product, it's really challenging to see that waste occur.
So Karen, I want to ask you, insurance companies say when they decide the pharmacy and send it to the infusion clinic or hospital, it saves money. Do you agree with that?
Well, the insurance company may certainly save money in this process, but when you think about the patient and their hospital or their clinic, that's where there are problems. So for patients, if their medication is delayed, they may have to reschedule their appointment. They might have to miss work, and we've heard that happen a lot, that they've had to miss work because of the rescheduled appointments. And for hospitals and clinics, they have to spend a lot of staff time tracking down the medication and dealing with the problems that Leanne was just describing. And one other thing that we've heard from hospitals about is that the insurance company's pharmacy typically doesn't send supplies that are needed to get the medications ready for the patient. So that hospital or clinic then has to use their own supplies to get the medication ready to administer to the patient, and they're not reimbursed for that.
So Leanne, where are the pharmacies usually located that insurance companies want to use, and why is that an important factor?
These can really be national and regional pharmacies, not necessarily in the state of Kansas. And you know, there's shipping, but then there's other concerns, you know, for patients who have to spend a lot of phone time sometimes trying to resolve problems that they run into or trying to understand what's going on with their medication.
That is the worst, being bounced around on the phone, trying to figure it out and track it all down. So how long does it take for these drugs to be sent from like an out-of-state pharmacy, and are they able to be tracked kind of the way we track our Amazon packages?
Yeah, well, I would say we don't always know.
Right.
And you know, I think it's really highly variable when a outside pharmacy gets a prescription or an order. We don't know or have any visibility really to how long it takes to process it or why it's taking the amount of time that it is. And, you know, I would say it's not quite like Amazon. You know, we have really good visibility you know, to that tracking oftentimes. But just like any online order that you place at home, there can be unforeseeable delays.
Darn it. If everything could be as easy as ordering something on Amazon.
Yeah, and the, you know, scheduling, that makes scheduling here super hard. And so we risk wasting time in our clinics when we've scheduled an appointment for a patient and we couldn't schedule another patient because we were holding that time. We've had patients have to make multiple trips, you know, if there was some delay and their med wasn't here when we thought it was going to be.
Yeah, problematic. Karen, do we know what percentage of insurance companies are using this practice? What do we know? Give us some numbers.
Well, we know over the last 5 to 10 years that the number of insurance companies that are requiring medications to be handled through this type of practice has increased. And I want to share with you some other information that we learned through our survey, and that was in regard to the amount of medications that are now required by many insurance companies to be white-bagged. So just about 6 or 7 years ago, only a handful of medications would have been subject to this practice by patients' insurance companies. And then if you see to the right side of that graphic, this year there are many, many more medications that are being handled like this by insurance companies. And Leanne talked about the amount of time and the rescheduling and all that happens. And these are really sick patients, so it's very, very concerning. And you can see how much that problem has grown over the last several years.
So Leanne, what if hospitals already have that exact medicine on their shelf? Do they still have to wait for it to be shipped in?
Well, you know, I think that's the hardest part for our doctors, our nurses, our pharmacists, because we're the face of this. We're the ones trying to explain it to our patients. And for some insurance companies, we can ask for an exception and they will grant us a one-time you know, ability to go ahead and administer that drug. But in other cases, we are not allowed to do that, and that leads to more difficult decisions for patients with a serious condition where a delay is not okay. And that might even lead to a hospital admission.
So Karen, let's say I'm a hospital and I decline to take part in white-bagging. Is that a choice? If so, what would the consequence be for a patient?
Well, we did learn through our survey that more and more hospitals are declining to allow white-bagged medications at their facilities. And what this means for a patient is that they may have to travel farther to get to a different provider to administer their medication. And in rural Kansas, that can be really problematic and a long travel time for them. But the reason that hospitals are declining to accept white-bagged medications is because of their concerns about patient safety.
So Leanne, does the KU Cancer Center, does it allow for white bagging?
No, we do not allow white bagging in our cancer center. And for really any of the serious conditions that we treat here at the health system, safety and quality of care is our #1 priority. And we spend a lot of time trying to continuously work on improving the safety of our processes. And so when we have, white bagging that causes, us to change or miss certain steps in our process, then, that's when, white bagging is not okay.
Right. Well, thanks for making that clear about how we do things here. But Karen, do we know of any situations, any patients who have actually been harmed because of this practice?
We do know that. So the Kansas Hospital Association asked hospitals across the state to share their stories from their patients about how white bagging has impacted them and their care. And we heard many examples of a patient's care being delayed because the medication didn't arrive in time for their appointment. It may not have arrived at all, or if the dose of the medication changed during the time that the medication was shipped by the insurance company chosen pharmacy to the time that it got to the clinic or the hospital for the patient's appointment. And that's especially concerning when you think about the seriousness of the conditions that these medications are used for. For patients who are harmed, there are processes at the Kansas Insurance Department and the Kansas Board of Pharmacy for those patients to file complaints. They can do that online or in writing so that those problems can be documented and investigated by those agencies. It can be done online or in writing, and the Kansas Insurance Department will actually take complaints over the phone as well.
All right, so Leanne, there's something our audience may not be aware of, and it's called the Drug Supply Chain Security Act that ensures that drug product integrity during handoffs of the supply chain. So could white bagging run afoul of those provisions? Kind of explain that for us.
This is an act that was put in place to basically improve the safety of drugs during the process of them being distributed to us. And so there's a lot of steps that pharmacies are required to do to make sure that we are accessing medications from a reputable provider or a reputable distributor, and that they've been safely stored along the way. And so, of course, this is something that national organizations and hospitals have been approaching the FDA and lawmakers about, because it doesn't seem like white bagging quite follows the same steps.
Okay, and here's an important one, Karen, for you. Are hospitals still legally responsible for a patient even if they can't verify the integrity of those outside medications?
There are federal and state laws that hold providers responsible for the safety and the quality of the medications that they dispense or administer to their patients. The problem with white bagging is that this practice takes control of medication safety away from the patient's pharmacist or their doctor, because once that's shipped from that third-party pharmacy that the insurance company chose, that they don't have any relationship with or control over, they don't know what has happened with that medication between getting from the insurance company's pharmacy to the clinic or the hospital for administration to the patient.
Yeah, that's concerning. So is this something that state lawmakers across the country or even here in Kansas are getting involved with? Where do we stand?
There's been a growing concern over the impact of white bagging on patient safety and quality of care over the last several years. And 2 years ago, 3 states enacted white bagging laws. Last year, there were 10 states that were actively considering white bagging legislation. We do have laws in Kansas that protect patients and the safety of their medication, but the problem is those laws predate this practice of white bagging. So our laws in Kansas are behind. The Kansas Hospital Association supports the Kansas Board of Pharmacy efforts to put into place some practical protections for patients, like a patient consenting and agreeing to have their medication white-bagged, or an agreement signed between the pharmacy that the insurance company chose and the hospital or clinic that their medication can and should be white-bagged. It just makes sense to have the patient's pharmacist and the doctor involved in that process to put some checks and balances in place.
Sure. Right, great information. You may still have some questions, so ask those by using the chat on YouTube, Facebook. You could tweet us or email the Medical News Network, the info right there on your screen. Let's get our COVID count today. Dr. Dana Hawkins joining us. How are you?
Hi,
Happy Friday.
Yeah, I know, it's good. It'd be nice and warm this weekend.
Oh,
too,
yay.
so.
I love it.
So again, we are going back to kind of weekly reporting of our COVID count. The COVID count for active infections really remains unchanged. We had 7 active cases here in the hospital. We'll come back next week with some new numbers.
Okay, so I like this question for you because when I go to get a shot, they always say, which arm do you want it in, right?
Right.
Like you have a choice.
Yeah.
Okay, so this is an important one then, as we talk about getting our flu shots. Could it make a difference which arm you stick out for the shot? The journal eBiomedicine found the immune response may be stronger if your booster goes into the same arm as your last COVID-19 shot. Oh my gosh, how would I even remember where that went?
Yeah.
So what do you make of this and how important is that?
So, I mean, as far as you remembering, obviously, we try to say get it in your most dominant arm because you're going to be using that arm more. That will help work out some of the tightness and discomfort, and also get that solution, through your cells, through your blood system, into those germinal centers, those lymph nodes. What are those? Those are the areas where you take up that antigen and where you have that immune response that really starts with those T cells and B cells starting to develop and mature. And so why is that important? This study looked at people's immune response, again, just as you said, who got the vaccine or the second dose of vaccine in the same arm as the first or the different. And what they found was that in those germinal centers, in those lymph nodes, you probably had more expanse, more increased immune response, particularly with CD8 cells and with the neutralizing antibodies. So that is important to know. It's certainly mechanistically, it is reasonable to understand that, because if you already have a bunch of cells there that are working, your immune cells in that lymph node, on that same arm, in that same area, and then you reintroduce that antigen, you just have an expanse of that. So it's certainly reasonable. Now, what does it mean clinically? It's really unclear if it means that you are going to have better protection, number one, against possibly infection, but also severe disease. So it is not clear that there are benefits with that. But again, this study was also done very early on when the vaccines were available. This was in 2021. How has things changed now that people have gotten multiple doses of vaccine, plus either been infected or reinfected? But certainly moving forward, if you are getting a series of vaccines, certainly the shingles vaccine, you have 2 things like hepatitis A and B, you have 2 or 3 doses as well. Certainly moving forward, it's not unreasonable to get it in the same arm. And again, usually we say get it in your dominant arm because you're going to be using that arm most of the time anyways, and that will help with the discomfort. So hopefully that helped.
Yeah, just pick an arm and stick with an arm.
Absolutely.
Okay, I can remember that. All right, any reporters with us today? All right, let's get to some community questions. And Catherine wants to know, are Medicare and Medicaid patients affected by white-bagging? Who wants to take that one?
Excuse me, Medicare and Medicaid don't enforce any type of, white-bagging. Normally we can use the medications that we have on hand for those patients.
Okay, Yen Liang wants to know, could white-bagging lower down the price of cancer drugs? What kind of effect does it have on pricing? Do we know?
Well, as we talked about earlier, it might save money for the insurance company, but we have not seen this practice translate into savings for patients or hospitals or clinics. But we have seen a lot of examples where it actually costs the hospital or the clinic more, and certainly costs the patient in their time, maybe time missed from work, and also just the stress and anxiety of not knowing if their medication is going to arrive on time.
Cindy wants to know, as a patient, should I be asking my provider about this? Should this be a conversation you're having in clinic?
It's probably not necessarily a conversation for clinic, other than to, make sure that, the clinic and your order, you're being really proactive about getting that order started, because just starting the process is how you're going to find out kind of what your benefits require, unless you're able to call in advance.
Okay, so Diana has a question. I'm going to read it. She says, I received an injectable in a box very similar to the one shown with ice packs in the box. However, often the ice packs have melted and they're no longer cold when I open it. I usually refrigerate the medication for a few days until time to administer it. Should I be concerned? Is it still safe to use? Just not sure what to do.
Yeah, I think that's a really good question, and I would encourage her, if she has any concerns, to call her pharmacy that sent the prescription to her. We have information on how long medications can be out of the refrigerator, and usually there is some time in that transition from receiving to getting it refrigerated. That's okay.
Okay, right.
We talked about earlier, and we saw in the clip that sometimes when drugs are misplaced somewhere, or recently I was aware of a med left on a porch for a whole week, and then yes, we would need to send some more medications
okay.
out.
So just with drug shortages, and maybe in particular cancer drug shortages that we've heard a lot in the news lately, how does the health system prepare for that and handle situations like that? Because I don't think we've really been affected by it, but that is a question we get a lot on how we make sure that our cancer patients are being treated properly.
We are most definitely affected by drug shortages. Probably we've talked about that on another morning medical update, and we're constantly monitoring our supply. Months ahead. Trying to make sure that we know about how much we use, about how much we're going to need. And if we need to, then we start having conversations with our doctors about alternative therapies and, other options if that's something that might need to take place.
Drug shortages happen, and you just have to anticipate them, like you said, months ahead.
Well, and I would just add to Leanne's comment, too, that from the Kansas Hospital Association's standpoint, we're monitoring it as well, and the impact to hospitals across the state and the patients that they take care of, and keeping in constant contact with state and federal officials as well, letting them know of the impact and putting the pressure that we can on those agencies, and keeping our federal and our state delegates aware of the situation.
Kind of a double question from Colleen and Sam. Do I have a say in this? What should I do if I don't like this practice? How do I have my voice heard?
Unfortunately, typically patients don't have a say in it, or at least right now we're realizing that they may not be aware that this is happening until it happens to them and their medication's not there when they go for their appointment. So I would say it's really important to talk to your medical team about it, but also talk to your legislators and your state policymakers and your insurance company. Let them know your concerns, and especially if you have been impacted by this process.
So kind of along that same message, Beth wants to know, just as a patient, should I worry? Is there any worry I should have when it comes to white bagging?
I would say I don't want the patients to worry. We are, watching out for that. I think the pharmacies, like we talked about earlier, when, the pharmacy receives something that, is not the right dose, not the right, storage conditions, any of those things like that. Healthcare providers are still responsible for making sure that we're administering the right thing,
no matter where it comes from,
and a safe product.
Got it.
And the unfortunate part for patients is sometimes the delays when something changes.
So gotcha. Okay, I want to get our takeaways today. Such a really, really important conversation. We talk about all sorts of things, and this is just something happening in the healthcare industry that many people may or may not know of. So thanks for bringing it to the table today. Karen, what's the takeaway?
I would say, we really want people to know that this practice of white bagging is an insurance company mandated process that really has introduced unnecessary risk into patient care and could delay treatment, and also introduce real safety concerns too. And so we support just some real common sense protections to be put in place to make sure that a patient's medication is safe from the time they leave the pharmacy until the time that it's administered at their clinic or their hospital.
Leanne, what's the takeaway today?
You know, for us, our patients and their care is always our primary concern. And so some of the challenges and risks that are created by white bagging make it honestly harder to provide day-to-day care.
All right, thank you for this deep dive into this conversation. Learned a lot. Appreciate you both. Thank you. Thank you to all of our viewers as well and your questions. We'll see you back here Monday. Have a great weekend. Coming up Monday on the Morning Medical Update. On Monday, an update from Dr. Douglas Burton, a spinal surgeon at the health system who also happens to have glioblastoma, an aggressive brain cancer. His journey and push for awareness of one day finding a cure for this devastating diagnosis. Bring your questions.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.